And joining us from Pittsburgh to discuss the issues in more detail is Dr. Amesh Adalja, a senior scholar at the Johns Hopkins Center for Health Security at the Bloomberg School of Public Health. Dr. Adalja, let's start there. So much hope with the new year, with the vaccine, but this rollout seems so slow right now. Why?
There's multiple reasons that are holding up these vaccines turning into vaccinations. One is that delivered doses isn't the same thing as an administered dose. And when states get these doses, there is a process before they get them to their hospitals, get them to their nursing homes, and they have to figure out to make sure that the priority is right, that the right healthcare workers are getting it. And there's a staffing issue, because you have to remember that many of these hospitals are dealing with the same patients with COVID that they now need to pull staff from and then create vaccination programs, and that's not easy to do. And the other thing is that states sometimes have unpredictability of when the doses are going to arrive. Sometimes doses may arrive late, sometimes they may arrive ahead of schedule. That's why there needs to be federal coordination, federal leadership, because this hodgepodge network can't deliver vaccines at the pace that we need to put this pandemic behind us.
Doctor, some are predicting that tomorrow is going to be the busiest travel day since the pandemic began. Hospitals already being pushed to capacity. I know you're heading to the hospital right after this interview. How concerned are you right now about January?
I'm very concerned. We know that there has been a surge of cases starting out even before Thanksgiving, then augmented by Thanksgiving, then Christmas and New Year. So we're going to continue to see cases rise. We're already at record hospitalizations. And hospitals really can't, in a sustainable manner, go through day to day worrying about supplies, staffing, ICU beds. That all is going to push hospitals closer to the breaking point or crisis standards of care where they can't do their other operations. We already have hospitals that have started to stop non-emergency surgeries. This type of approach isn't going to work. We've got to get some handle on the number of cases and the number of hospitalizations. And to do that, I think we have to get the vaccine accelerated, because that's really what's going to give us breathing room in the hospitals. But that's going to take some time. So I do think January is going to be one of the more deadly months that we've seen in this pandemic.
Doctor, on top of that, you also have this new variant that we know is in at least 3 states. How concerned are you about that? And how do you think that changes the sort of containment strategies?
The new variant, it appears, has the ability to transmit more efficiently. That's what the laboratory studies are showing. That's what the statistical modeling is showing. So that means that we have to double down on what we're doing. We have to be better at washing our hands, wearing face coverings, avoiding crowded, congregated places. And that really also adds more urgency to the vaccination program, because we have to stay ahead of this virus that's constantly going to be evolving. It doesn't change anything specifically that we do in tactics. It just means we've got to do it better, because if this virus strain starts to take hold, you will start to see an acceleration of transmission the way they saw in the United Kingdom. And you can't really allow that to happen in this type of an atmosphere in the United States, where we have uncontrolled spread in many communities around the world, around the country.
You mentioned the UK, and in the UK they've decided to delay giving that second dose in order to vaccinate more people with the first. It's been something that's been discussed here. Where do you stand with that?
This is a hard decision to make, because we know that there is some protection that's given after the first dose, but all of the data is based on a 2-dose regimen. So that's where we're most confident that the vaccine will work. The UK made a decision based on their own standards. I don't necessarily think it's the same decision the United States can make. It was good to discuss it, but I do think that the 2-dose regimen is the surest way to do this. But I think things may change depending upon what the dynamics are and what data we get on just what a 1-dose regimen would do.
Okay, Dr. Amesh Adalja, thank you very much, as always.